And yeah, indeed, I'm going to talk about mostly about the paper that we've been doing. It's a quite recent paper, so we published in May. And yeah, the title is a bit misleading in the agenda. It says machine learning for drug discovery. While this is true, the title is actually a bit sexier. It's multimodal contrastive learning for drug discovery, and mostly about our recent paper. But yes, in addition to myself, so again, I'm Philipp Seidl. I'm from JKU Linz, Austria, which is in the heart of Europe, Austria. And yeah, so let's start off by some personal story and motivation of why we're doing what we're doing. This was something when I was, that was 10 years ago, when I was walking down the beach of Nicaragua and caught myself one of those things. It was growing by 1 centimeter every day, and at first I wasn't really worried, but then got to the doctor. He gave me some medicine that wasn't actually approved in Austria, only for horses. You might have known this compound. It was ivermectin, and yeah, the funny thing is I took it, of course, because I had no other choice. It got away right away, and I had no side effect. But this is actually quite a miracle, right? So you take this compound, it gets ingested by your body, and it only targets the worm that was affecting me, and it was not interfering with any of my 20,000 proteins. And this is actually quite astonishing that I haven't had any side effects. And yeah, we take this for granted, but actually it's really a miracle. But in general, drug discovery is a really complex process. So it takes, on average, up to 10 years to develop a drug, and the costs are in the billions. And actually, there is the inverse Moore's law, so it's getting more and more expensive by the time we develop medicine. And the first phase of developing a drug is to conduct experiments, those so-called assays. And in those assays, we have biologists, and the biologists, they try out a lot of compounds. Yes. But the question here really is, how do we actually find good candidates to test? Because the chemical space is huge. It's estimated to be in the range of 10 to the power 60. This is a really unfathomable number. This is more than atoms in our galaxy. And the next thing is that typically very, very few active molecules are found. So the research question is, can we aid in finding more informative molecules for our new experiments? So let's talk a bit more about how those assays are conducted. So there are different kinds of assays. So for example, assays can be conducted in cell cultures, but also in living things or on dead things like viruses. And there is another kind of assay, which are high-throughput assays. High-throughput assays typically are very noisy, but you measure a lot of molecules, so you also get a lot of information from them. And again, the goal is to find active compounds, so something that inhibits a virus or some kind of cancer. But another important thing is that, of course, you all know the dose makes the poison, and if you take a drug, it's, of course, dose-dependent, and that's the same thing with those assays. And there we try to find molecules which, at the very low dose, already elicit an effect. And we can be quite thankfully, because there is quite large amounts of data that are out there. So in PubChem or Campbell, those biologists will take their experiments, the results of their experiments, and put them online for free. And so I've put down this example here where I searched for SARS-CoV in the PubChem database, and this is something that shows up. So what you see here is there are 3,100 assays, so experiments that biologists have conducted. And here, the first results, I will read out a bit. This says QFRET base dose, so it describes kind of like the procedure and how the readout was going to. Oh, we see it's a high-throughput screening assay, and it's again about SARS-CoV and the 3C-like protease, which describes the protein that is involved in this experiment. But you can see already that this title here gives a lot of information of what was going on. And let's imagine we're all back in 2020, where there was only information about the SARS coronavirus 1. And already there we had, if you look on the top here, we had almost 100 results. So back in May 2020, we could have already used those results to further our understanding of which compounds might work as a potential drug for coronavirus. And that is actually the problem of zero-shot drug discovery. So you haven't conducted the experiment as of yet, but you want to conduct experiments, but you already want to narrow down which search space you're going to use, or which compounds or molecules might be potentially active. And if there is no training data available, this is very hard. But what an expert would do, he would look at the database, as I did before, and search for similar assays. And another thing that people might use is the 3D structure of the protein, right? You could use that and then drive. This is called docking, and this is another approach, but I won't dive deeper into this. But we suggest something different. We say that you could actually use the textual representation of the experiment. And I will later explain how we do this. So again, typically what is done, we have our molecule encoder and it's trained. We get our hidden representation from the molecule encoder M. And what we then do is in our last hidden layer, can I use a laser pointer? Yeah, there's something showing up. So in our last hidden layer, we have some WA, which is at the beginning randomly initialized. We do a dot product with our hidden representation to get our estimate for some property. And those properties, really, they vary a lot. So it can be toxicity or the inhibition of a virus or if it penetrates the blood-brain barrier. So there are a lot of properties that are of interest to the scientists. And yes, if you do this and we don't have any data, of course, those weights will still stay in the initialization and we won't have any information. But one thing we can also do is multitask, right? We don't just have a single task, we learn on multiple of different tasks. And what this gives us is a shared representation. So the training of this molecule encoder really benefits from the shared representation, the signal of the shared representation that is between those different tasks. But also, how would we adapt this for zero-shot, right? It's not trivial. Something that has emerged in recent times are the scientific language models. For example, Galactica is one of those scientific language models. And here we have, again, one of those huge transformers, and we would model both. We model that scientific text, but also have chemical structures in them. And actually what this allows to do is zero-shot drug discovery. We can type in the kind of experiment that we want to conduct, but also the structure of the molecule. And we get some representation out. And from that representation, we can infer if the molecule would be active. One of those examples is Galactica, and typically the way those models would be trained is your typical masked language modeling or next token prediction loss, then combined with some cross-entropy on the final tasks and fine-tuning phase. But we will later show that we found out that this is quite suboptimal for the current approaches. Here's another baseline, which is actually quite naive, but works surprisingly well. So instead of trying to learn what, for your specific task, if a new molecule will be active, what you do is you rank them by their average activity. And this works surprisingly well. And those are quite known in the literature. Those are so-called frequent hitter. And if you know, for example, or have read studies where curcumin, for example, it has all kinds of health benefits, right? Curcumin is one of those frequent hitters. In experiments, it will show up for a lot of tasks as active. As you all might infer, is if it's active everywhere, it might not be very specific and the effects might be very limited. Also, one reason of why they might be active everywhere is actually because they interfere with the measurement process, so-called paint structures, but I won't go into the details. And they are related, but not the same. Yes, so this is actually a quite good baseline, as I will show later. The next thing, as we've done before, we have looked at similar or related assays, and we can do something in an automated way. We can go to the database again, the assay descriptions, and we look if we have now a new assay description, SARS coronavirus 2, and now we're interested in the spike protein. We can go back in our database. Oh, this is here. Here we have SARS coronavirus 1 again, but the 3CL protease. But still, let's learn something on what we've found out here. And we take, so to say, the first row of this column here, of this matrix, and take this task for our new prediction, so our new assays. And this we call the one nearest neighbor baseline, but you can also do it in a soft way, and the soft way is then determined by the cosine similarity to the essay description. But we propose something even different, even more powerful. And we call our method CLAMP, Contrastive Language Assay Molecule Pre-Training. So what we do is we make this fully differentiable. What we have here is a molecule encoder, again, as you've seen before, the hidden representation of the molecule encoder. But here we do something different now with the assay description. We also have a text encoder, and the text encoder also produces some latent representation. And now we make them similar if a molecule is active. So I will later talk about the loss function that we use, but essentially all you have to imagine is we want those representations that we get out from the molecule, this high-dimensional representation, to closely match the representation of this experiment, the assay that we have conducted. While at the same time, for the ones that are inactive, we want them to be dissimilar of this representation. And what we get here is really powerful. This is a multimodal association space. And the same thing has been shown for those of you who are familiar with the word CLIP for images and text too. And what you learn is a really rich representation. And now you can use this too for zero-shot drug discovery, right? Because you can type here a new assay description and figure out if a new molecule is active. And the objective function you can see here, essentially what it is the binary cross entropy on each of the individual connections that you get when you sample a mini batch of molecules as well as assays. And this has been found out by colleagues too. They called it SIGLIP sigmoid function, and it's actually quite interesting because it's more parallelizable, but also works better and is more scalable. And again, for those who know CLIP, what CLIP does, it can assume that the off-diagonals are always inactive. We can't assume that because for most of the connections that we draw, we don't know. Most of them are dark. So in PubChem, 99% of the measurement matrix is unknown. And here in CLIP, we take the cross-entropy loss in this direction as well as in this direction here of y, y minus y hat. But here we can't do that. And this is also related to some prior work that we've been doing in which we don't take assays, but here we take templates. And this is the task of retrosynthesis. So you given a molecule and you want to figure out how you can actually make this molecule. And what you can do is you can predict templates. So those are symbolic rules. And you can also learn them contrastively. In this approach, we've gone to a slightly more complex solution, but you can think of this still as making this representation and this representation more similar if they match together. And also with the templates, there are thousands of templates, and for some of them, you have very, very limited data. And this is essentially where this architecture shines. Let's talk a bit more about the experimental section. So here you see the data set that we have gathered. So we take PubChem, and now you have a huge matrix in which you have the assays, the experiments that have been conducted, and we sort them by time. Then we make a training set, and we do the same thing for the molecules. We sort them by time. Well, this is a bit hard to do, so we take the ID, so at which point they were entered in the database. And now what you do is you train on this kind of blob here of the data, and now validate here on assays that you have never seen. Again, this is zero shot, and it has not been performed before. And this is what previous methods do. They take the training set and then test on this subset here. Something very, very challenging you can also do is, and this is the time_AC set, shown here. You only evaluate on assays that you have never seen, but additionally also on molecules you haven't seen. So here you're also probing for the out of distribution for molecules, the capability. A second data set that we've looked at is the FSMOL data set from Stanley. This is way smaller than this data set that we gathered, but it's been used for a few shots. So in this work you will get 16 examples, and then you have to know what the results are for other but at least you get some examples. And we have extended this work to also be able to do zero-shot. And then for the downstream task, we take the very well-established molecule net dataset. So here again are the methods compared. I already explained a lot of them. Maybe for the scientific language models that we used, there we used Galactica and KVPLM, but also Multi5. And again, for CLAMP, the molecule encoder can be arbitrary, it can be anything. We tried out graph encoders, but also SMILES encoders, but really found that descriptor-based methods work very well, but also combinations of them. And for how do we encode the assay description, the text, there we experimented with BioBERT, which is specifically trained on biological data, but also KVPLM, Galactica again, but also CLIP. CLIP has been trained, so the text encoder of CLIP has not been trained at all at the biological domain. It will be interesting how it stands out. But we also used something very naive, which is the LSA, which just is a bag of words model, and then you do PCA on it. Yeah, we have 3 sets of experiments. The zero-shot transfer learning experiments about representation learning to test the robustness of our molecule encoder, and the third task is a retrieval task. So let's talk about zero-shot learning. How does CLAMP perform for unseen tasks and assays? Again, as I've alluded, we test on unseen assays, so assays that have been conducted after 2018, only given the assay description. So this is how our results turn out. Maybe let's talk a bit about the metric we're using, because it's not a standard metric. We use the delta average precision, which is the same as the delta area under the precision recall curve. What this focuses on, so most of you are probably familiar with AUROC, but the delta average precision focuses much more on the positive, the compounds, whereas AUROC has an emphasis on both the actives but also the inactives. But what we care much more about is about the active molecules. So here, this metric, delta average precision, is much better. And the delta is because you subtract the base rate in order to make the average much more stable. Yes, and if we look here, methods like Galactica, they have not been trained specifically for this. And as you see here, they fail in this zero-shot task. Here they get, in this, interestingly, a performance of 0.4. KVPLM actually performs better in this task, but still the one nearest neighbor is way better. But what is a lot of times even better is the frequent hitter. So for example, in the high throughput screening assays, we see that the frequent hitter performs better than the one nearest neighbor method. But all of the methods get outperformed by our fully differentiable method. Okay. And here is an excerpt of the results on a newly trained model. What we look here is on SARS coronavirus 2 assays. And here what you see is, again, you get a delta average precision of 11%, which is quite astounding. This is not for every assay, as you see here. So sometimes it will completely produce garbage, but for a lot of those assays here, for example, it produces actually quite good results for the new variant of the coronavirus. The second thing we looked at was at representation learning. So what you do is you take the molecule encoder, train it as previously, as I've said, contrastively with all the molecules as well as the assay description. And now what you do is you only look at the molecule encoder and take it as an encoder. So you take a huge database of molecules, encode them, and save your hidden representation. And then you do minimal adjustments. Here we took a logistic regression model and trained it on top of the representations we get from CLAMP. And we tested on the very well-established molecule net dataset. And here are the results. So if you take the CLAMP molecule encoder, you get very good results. But also other methods perform very well. Here, for example, we see BART SMILES in the base or BBBP. This performs very well. So CLAMP is not everywhere the best results. But still, for a task like here, for example, Seidl. Seidl is a very complex task in which you have to predict the side effects that will arise for certain drugs, which is a very high-level task because just modeling the whole complexity of the body and which side effects might arise is very complex. And here we see if you take the representation, you actually get a very, very good result for this kind of task. And again, here we see the delta average precision more focuses on the positives, but also AUROC results are in the appendix of our paper. The last task that we have been conducting is a retrieval task, right? Because what you can do now is you take a huge database. In our case, for our examples here, we take a database of 10,000 molecules, but also 1 million molecules. And now what you do is you can query this data set. You simply type in what experiment you are going to conduct. And in our case, for the CLAMP results, you only have to encode the assay into the hidden space and then make an inner product, a dot product essentially. And this is very fast. You can even use packages like FICE, and this will run in no time. So retrieval is very, very fast. And what we see here is that we outperform other methods by more than 20 times. And this shows the enrichment factor and shows essentially how much more better than you are at figuring out which molecules have been measured actively in this task. So it's an average over a lot of assays. Yes. And
so this is a ranking of molecules.
Yes, so you have your database.
Into assay.
You have a database of 1 million molecules, and then you have a lot of measurements of those molecules. And here the task is, which is a very challenging task, right? You want to rank the molecules that you have measured and were active at the top. How do you know which ones are measured, right? You don't even know that. But still, you want to have that the molecules that you rank high, or every method has to rank the ones that are measured active very high.
Yeah, so you evaluate on, I don't know, 100 of them that are actually measured.
Yes.
But you rank the whole thing.
Yes, in this case it's 200 something assays, and here we take assays where we have at least 200 measurements. But the details are in the paper.
Yeah.
But yeah, again, this is very fast, but other methods, for example, if we take Galactica, which is a transformer model, what you have to do here in order to make this ranking, and that's why we could only do it for the 10K case, is you have to perform every combination and run it through the transforms, right? It's not just a dot product at the end. You have to go through every combination, and this takes, if I remember correctly, for this example, it would have taken us more than a year to run this experiment. To go over 200 times 1 million of those examples in order to get the full ranking. Yes. There is even one more thing. So there are in the literature those, let me see how much time. Okay, I still have 5 minutes. I'll go over this very quick. So in the literature, there are so-called high throughput fingerprints. What you do is you don't represent the molecule as by its structure, but you take the measurements that you have. So this vector you would take and do a logistic regression on top of it for new assays. And you will get, so for Laufketter in the literature, you will get this performance here. And actually, so you can get better by adding a structural information. This is the bash. But both have a significant drawback, which is if you don't have any measurements, you can't use it. But CLAMP, as we see here, outperforms all of those methods, while also being able to only rely on the structural information, which you can use even beyond if you have measured data. Yeah, so to conclude, presented CLAMP. This is a new tool for zero-shot drug discovery. We hope that this aids in the future to find more informative active compounds for new experiments. It's very fast and accurate at retrieval, and the code and also models are online to try out. Yes, and with that, I want to say thanks. Thanks, first of all, for inviting me to this conference, but also for the collaborators and our sponsors, and of course, your attention.
Thank you. Do we have questions?
Yes, can you shout it out? I think it's easy.
Can I use Galactica for quantum chemistry modeling and calculations, not being a quantum chemist by myself?
You might be able to use it, but the thing is, what comes out, I don't think it will be usable. So I have no straightforward way of putting in quantum chemical calculations into a transformers, but there certainly are ways, and you could fine-tune a model doing that, yeah. But out of the box, I would suspect it wouldn't work. Yes?
Thank you for speech. Can you explain why you are using Philipp via new method?
In this case, we didn't use the help field layer, so that was the. Let me go back. I'm sorry for that confusion. I was thinking a lot if I should even include this here, but yeah, it says here it's a detour. I should have been more specific. This is just related in terms you also increase the similarity between this representation and this representation. But what you do here is, and we found that this works a bit better, but it also works just if you use the traditional method of making the two more similar. But here what you do is, you have again a second step, and in this you will use the modern Hopfield network, in which you multiply, so you get a vector of similarities between your molecules and your templates, and then you will take the softmax, multiply it by some temperature parameter, multiply it again, so you will get a sort of a prototype of all templates, and then at the end add this again. So you would have multiple steps, in our case 1 or 2 was a good hyperparameters of those steps of enriching the representation that you have found here, and adding it again to your xi, your pattern that you're looking for. Yeah, I hope that wasn't too complicated, and it is quite, yeah. But here, this is much more simpler. It's just you do the inner product between the molecule encoder and the assay description, just like in Philipp. Yeah. But it might be interesting what happens if you do multiple steps. Yeah, we haven't tried it out.
Molecule encoder will
Yes.
have fingerprints on it?
Yeah, thank you for that question. So, right, it's still ongoing research to figure out which molecule encoder to use, right? There are so many molecule encoders out there. So this is just one. Here I tried to figure out from the literature which molecule encoders are proposed and have been used on MoleculeNet and have the same split. There are tons of them. So in our experiments, what we found out, of course, if you use multiples, so you use them all, you get the best performance in the case of FSMod. But this is very time consuming. So here you take CDDD, MFBERT. I think here we used all also, yeah. But what works surprisingly well and fast is just if you use the Morgan fingerprint as well as the RDKit fingerprint, concatenate them, or in this case, just add them. But yeah, but also methods like CDDD or KVPLM performs quite well. But yeah, it's still a debate which molecule encoder to use.
And you had a KNN baseline which was quite strong, right?
Mm-hmm.
In KNN, you can also ask this question: in which?
Oh, yes. So right, in the KNN, how do you find the nearest neighbors in this space, right? So here, we learn this, right? So we have a similarity that we learn. Here we have to have prior knowledge, and what we do essentially, I'm sorry again.
I'm asking about the baseline.
Yes, so the baseline what we use is the cosine similarity in the bag of words, so the TF-IDF vector of this assay description. So TF-IDF will look at words that appear frequent, but are also informative for each sample. And you will also do a down projection, which is then called LSA, local semantic analysis. And you will use that for representing the text, and then you will do the cosine similarity. And this gives you, this is the similarity metric that you will use for text.
Okay, but then I don't get how you have to calculate it for molecules as well, right? So
no, for molecules, here you encode them.
no, I mean, you go to that slide where you had this table with KNN baseline for the assays. Yeah, that's one.
This one? Yeah.
You have one.
So,
right?
again,
Here you were taking.
so you train a multitask model, right? The multitask model has all of your tasks that you've seen in there. And then you go and look at the text, which of your tasks was most similar in the cosine similarity space of the assay description. And then you just take this task, and with this output of the model, you will predict on the new assay.
Oh, so you do. Okay, I think I misunderstood that. So
Mhm.
you use KNN to retrieve the model.
Yes, you retrieve the model essentially, yeah. And use the model then to predict the new assays that you've never seen. Oh, there is one more minute. Okay, thanks. Yeah, any more questions? Otherwise, please talk to me offline. I will be here the next 2 days. Yeah, tomorrow. Yeah, sorry.
You use Galactica to like.
So I use Galactica as a baseline, right? And also to encode the assays.
Do you encode the essays using Galactica? What
Yes.
size is that?
I think so. We tried out multiple sizes for. Let me think. That's a very specific question. For one, we used only the small model. I think for the retrieval, because the other one would have taken way too long. But for our baseline in which we encode the assay, you only do it once, and then there we take the largest model. Yes, and also something that is quite important here is the molecule encoder, as we also took Galactica, those are not trained end-to-end. So you would encode, have the hidden representation, and then turn, so to say, an adapter on top of it. This speeds up the computations by a lot. And we've tried out to do this end-to-end, but when we did it end-to-end, the results were worse, but the results are not in the paper. But this is also quite interesting that but there's additional hyperparameters that then happen. For example, tuning the learning rate. One of the neural networks that you learn is way smaller than the others, and yeah, there multiple things are involved. But this might be something to combat in future work. Yeah, one more question?
Have you tried ablating the molecular information?
Yes.
And information?
So the molecule encoder ablation is results for this molecule encoders. Sorry. Yeah, this is the molecule encoders. What we see here, we don't have results for all of them. I only included the ones where I ran a lot of experiments. But again, what we see here is that fingerprints work very well out of the box and don't have any hyperparameters. But also for some tasks, for example, CDD works well. And we've mainly done the experiments on FS small simply because it's way.
Yes, sorry, I meant updating, like not providing molecular information at all, and just using the assay information.
Yes. So if you only use the assay information and then, so to say, you rank your assays by, we've done those experiments, but I didn't include it in the paper. But it's actually, so you do the retrieval in the reverse way, right? You take a molecule and try to retrieve the assay in which it would most likely be active. And then you would have a frequent assay model, so to say. I actually don't know how the results at the top of my head, but they were not too interesting to include them into the paper. Yeah, as so often. There's a huge iceberg of things you have run and you only show the tiny bit. That was interesting, yeah. One more question, or I think we're done. Otherwise. Here? That's the sequence I'm building. I don't know, which one is it? That's the middle one, okay. Middle one for the molecule encoder. That's different. But we also have it for the assay encoder. Sorry. Oh, no, this is also 6.7. So it's the middle one. I'm sorry for the misinformation. Yeah. But also, this is quite interesting. For the molecule encoder, it performs very bad. But it has only been trained on on PubChem, as well as some parts of molecule net. Yeah. Yes, I think that's it. Thanks again for your attention, and
thank you.
Okay.